Hello, my name is David Roye, and I'm the Director of Pediatric Orthopedic Surgery here at the New York-Presbyterian Morgan Stanley Children's Hospital. I'm also the St. Giles Professor of Pediatric Orthopedic Surgery here at the medical school. It's interesting that I chose pediatric orthopedic surgery. It actually wasn't hard. And I know that medical students often have a hard time thinking and choosing about what they're going to do for a lifetime. But I had the advantage of being a little older coming into medical school. I spent a few years in the Army during Vietnam, and when I came back, I really understood when I entered medical school that I wanted to do something with children's health. I can't really articulate exactly why, but that's what really attracted me. And the ortho part was pretty easy because I married before I did medical school, and my father-in-law was an orthopedic surgeon, and he was an important role model for me, and I saw what a good doctor he was and how much he enjoyed his work, and so I combined orthopedic surgery with pediatrics, and it's been great. It's been a great run. I've enjoyed every minute of it. It's really not possible to treat children without treating the family, and that's why here at the New York-Presbyterian Morgan Stanley Children's Hospital, we have a family-centered care plan, and it's been a part of my plan or practice forever. It's kind of so obvious that sometimes we don't talk about it enough, but if I look at the kid's problem in isolation and don't consider the fact that how the parents are worried about it, or how that problem impacts on their ability to go to work in the morning, how it impacts on the other children in the family, and how that dynamic will impact on the ability of the parents to comply with the care. The Division of Pediatric Orthopedics at the New York-Presbyterian Morgan Stanley Children's Hospital has a worldwide, literally, reputation for patient-based outcome measures. We were almost 20 years ago, began developing instruments to measure outcomes in pediatric orthopedics in children, not done before. The instruments available when we started were only available for adults. Measuring those kinds of outcomes in children is very difficult, because you can imagine that the word child includes a myriad of sequential developmental stages, so you can't use exactly the same questions, obviously, for a 2-year-old as you use for a 12-year-old. And so this area was kind of left alone for a long time because people thought it was impossible. But we have absolutely been very involved in that, and I'm very proud of that research effort. The other areas that I'm particularly proud of are our contributions to the treatment of early onset scoliosis, and in both the areas of the technical aspects of the surgery, outcomes in those operations, and in addition, looking at how best to proceed with evidence, gathering evidence for the treatment of these children. It's our efforts as a division have led to determining what questions there are that we can say we have equipoise about. We don't know. It's like, should we treatment A or treatment B? Do you really believe one is better than the other? That is a very necessary step before you can actually advise your peers and coworkers to go ahead with a trial that's randomized. We've been instrumental in that, and also in heading a number of multi-center studies from other children's hospitals where we have taken the lead, particularly in the area of early onset scoliosis. Other people have the moniker Children's Hospital, but this hospital has the amazing depth, every specialty represented by several world-class experts, and the teamwork that I have seen here over my career lifetime has been amazing. That teamwork, that cooperation, that expertise makes us the best, and it means that parents should always bring their kids here. And I might add, that's the reason I'm here. I'm here not because of the building, which is very nice, not because of the size, which is also great, but I'm here because of the people. And the people that are here, the physicians, the nurses, the administrators, all those folks that are emphasizing the need for quality and patient and family-centered care, that's the reason that I'm here, and that's the reason the parents should bring their kids here as well.